From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed, with co-host Chris Mahr. Come to you every Saturday morning, 10 to 11. We also re-air on Sunday from 2 to 3. I want to thank Community Broadcasting giving us the opportunity in our forum in here to talk about all the medical issues and all the things going on right here in our good Sumter community, Florence, Columbia, Clarendon, Lee County. Chris, last week, enjoyed the show. Very, I think, insightful. Maybe one of our most insightful shows. And I appreciate all your insight. And for those that didn't catch the show, we talked about specifically the Beers criteria, which may to a layman be a term that they're not familiar with. But basically, it is some of the criterion that you have to look at as a physician when dealing with medications, Chris. Yeah, basically it's a list of medications that is recommended against use in elderly individuals. Yeah. Well, with our presenting sponsor, AYS, we have our website set up in which people, will contact us. And one of the questions, Chris, again, was reiterating your theory on flu shots. So we want flu shots. Agree? Yeah, absolutely. Flu shots. Fortunately, knock on something, flu I don't think has really hit yet. Yeah. I haven't seen any flu in my practice. I haven't really talked to our urgent care yet, but we haven't really seen a lot of cases with flu. That doesn't mean it's not coming. It's more than likely going to be here. And remember that if you're going to get a flu shot 3 to 4 weeks before flu season starts, because it takes that long for your body to develop immunity. So get your flu shots, get them early. Want to answer that protected question. Yeah. And we also talked about with your criterion of, and we got 2 emails on this, how important, emphasize again, Chris, how important it is as the physician that when you come to see your doctor to bring all your medication. Yeah, that was I really tried to hammer that point home last week, that it is so easy, so much easier to manage medications when all the pill bottles are in the office with the patient, and we can check them off and make sure that there's enough pills in the bottle and the refills are up to date, and there's not overlap. Sometimes medications may have a generic name and a trade name, meaning the same medicine has 2 different names, which confuses a lot of people. And so some people are taking double their medication because they've got bottles labeled differently. So bringing your medication into every visit, significantly beneficial to you, really help your physician give you the best possible care, making sure your refills are up to date, making sure you're not duplicating any medication, and making sure that the list that doctor has you on is the list that you're supposed to be on, that you are actually taking. And pill boxes. And pill boxes. Pill boxes are great, especially for elderly individuals, family members who may want to help them, maybe if you have attendants in the home who help with medication administration. But pill boxes are a very valuable way of keeping the medications organized, and making sure that you're taking them. And if that little slot is empty and all your pills are gone out of that slot, then you've taken them. So you're not in that situation in the evening and say, did I take my morning medicine? It's always that, did I close my garage door? Jeff, when you go on a long trip, how many times do you drive back in your neighborhood to make sure you shut your garage door? So it's the same thing in the evening. Did I take my medicine that morning? Well, if the little container's empty, you took your medicine. Great way to stay organized, and recommend them. Good deal. One final other from our first show of the year. Spoke with Missy Reese from the YMCA, and Chris, we had a great show the first week talking about all the weight we'd put. Have you lost any weight, by the way? Yeah, working on that. Good, good. Well, she said they have been just overflowing, so thank you to all the listeners out there. Get by, support the YMCA. For those that did not catch the show, on the first show, we described why we all have had to loosen our belt, myself included. We talked about all the foods that contributed to that, and probably our lack of exercise during those Christmas, Thanksgiving, New Year's times. And Chris, one of the things that you emphasized again, a lot of people not only neglect their eating habits and their exercise habits, but a lot of times their medication.
Absolutely. And remember with the Y, lots of good programs at the Y Fit program, get a prescription from your physician, and it's a subsidized membership. They have lots of classes there to for educational purposes as well as to keep you in tow, make sure you're doing the right thing. Had a patient this morning came in and she said, I've got lots of knee pain. And, what do I do?
You need to stop working 6 days a week, you crazy man, you. But go ahead.
I see patients on the I see patients on the weekend. So yesterday morning it was. Yeah. So so regardless, the patient came in and she's having knee pain, and she says, I have problems when I walk. It causes more pain using ellipticals and stationary bikes. Water aerobics, fantastic way to expend a lot of calories, low impact on the joints. So Y is the place in town to do that. There's no other place to do it. They have a really warm pool that they use just for water aerobics. Feels great on the joints. And a low
Silver
impact.
Sneaker program,
absolutely.
That Y Fit program. So I want to thank At Your Service Home Care. And again, you can reach us any questions after you listen to the show. We accept that by email. So we always want to address them, just kind of tip off our show. But it's at jreed, REED, at AYS and / homecare.com. And we will address any of the questions that you have. And again, Chris, last week we talked about with the elderly and some of the questions that a physician will face. And I think a topic that has gotten a lot of notoriety, and I got to be honest, I am a client of this, or this is I don't want to call it an ailment, but I have troubles going to sleep at night. And we talked briefly last week, and you gave some tips such as don't step and watch some anxious sporting events, which I fall prey to. Don't exercise late at night, which I wouldn't say that I'm prone to doing that. However, with kids playing basketball, wife is a basketball coach, and being around that, take Friday night, very much enthralled into basketball games up until 10, 11 o'clock at night. So I thought insomnia, the causes of it, some of the remedies, and to continue on with the way we left the last show would be a great way to start today's show.
I think that'd be great. Insomnia is a tremendous problem, and I treat it daily, treat it every day.
Yeah.
And so what I'm going to do when we come back, I think we have just a few more minutes. But when we come back, what I'd like to do today is talk a little bit about normal sleep, what sleep does for us, why we need sleep, some kind of interesting research about sleep in and of itself, and what sleep deprivation causes. And then we'll talk a little bit about the treatments and some of the diseases associated with insomnia.
I love it. We are Medical Forum, coming to you here 10 to 11 on Saturdays, every Saturday, and also, as we talked about, re-airs from 2 to 3 on Sunday. And topic today, something that affects, if not you, somebody you know dearly, insomnia. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
We are back. Good morning, Medical Forum. I'm your host, Jeff Reed. Chris Mahr in the house, and we want to quickly thank one of our great sponsors, Medi Home Care. You may also know them as Tri-County Home Health and Hospice, located on 2560 Tahoe Road, 905-7720. Fantastic operation there when dealing with any of your hospice, your home health, and medical equipment needs. Been a great staple in the community, great people to work with. They'll consult you, they'll educate you, and if you need their services, they are no better to have in their hands, Chris. Topic today, insomnia, and we just broached on it very, very briefly coming out of the first break. Talk to us about sleep, Chris.
So just to give you an idea of how much of an issue this is, I don't know if you ever read Consumer Reports, great magazine if you're ever going to buy a washer and dryer, but they actually did a really nice article. Let me tell you here. I'll even give them a plug in February of 16. So I guess I got this a couple weeks ago.
Wow.
And it's actually a nice article on sleep. I like it because the article talks heavily about non-pharmacologic approaches to insomnia. Non-pharmacologic means no drugs. Drug-free ways to improve your sleep. Lots of good information on here about things like mattresses. Of course, Consumer Reports always talks about what mattress is the best and who likes it. You can pull all that information from there. But a nice quote that they put, 27% of people in a Consumer Report survey of over 4,000 adults reported sleepless nights. And 68%, or an estimated 164 million Americans struggle with sleep at least once a week.
Is your interpretation sleepless like do not sleep, or is there a range you feel like from 0 to 4 hours would be considered sleepless?
Well, I think insomnia is a term that is different for everybody, and I will venture to say that some people require less sleep. Now, I think that's a perception, and I'm going to get into that a little bit more in a minute.
Okay.
Because we've always talked about children getting 8 to 10 hours of sleep a night, and there's a true misconception that adults need a lot less sleep than kids. It is truly a misconception. We all probably need about 8 to 10 hours of sleep a night, and that is not just so. Some people will come to their physician and say, I have insomnia. This is affecting my job. This is affecting my ability to parent, or affecting my life in a negative way.
Mm-hmm.
They may be getting the same amount of sleep as someone who just can run all day and not have an issue. But factors that could influence that, again, perception of sleepiness, use of substances throughout the day. And I'm a coffee drinker, and so it's a fair amount of caffeine in there, and I drink a couple cups of coffee every day.
When do you have your last drink as a norm? Or
so for me, Jeff, my last caffeinated beverage, especially on a night where I know I got to get up the next day, so I got to get up for work the next day. My last caffeinated beverage is 1 o'clock, absolute latest. I if I'm going to have an afternoon caffeinated beverage, it's at 1 o'clock, and at that point on, I drink nothing but water. Now, I'm not saying you have to drink just water, but I'm saying that caffeine can hang around your system for 8 hours.
Wow.
So at that point, 1 o'clock, I finished it at 1:30. That's 9:30. That caffeine's really just kind of starting to.
So if your
leave
vice
my
is
system.
Diet Coke or Coke, anything caffeinated,
Exactly.
highly recommended. The quicker you cut it off, almost use like a theory of like 8 hours minus what time you want to go to bed.
Exactly. So again, for myself, caffeine will really affect my ability to fall asleep, which I do not claim to have insomnia. I sleep very well without a problem. There are nights that I have trouble sleeping, but I've never had a problem. But again, if I drink caffeine, I have a problem. I'll give you a perfect example. When I was in medical school, I had a friend who was Cuban, and he had a coffee called cortadito, and it was fantastic. It tasted wonderful. We would drink it while we were studying, but we would study late into the evenings, and I would go to bed and have a complete inability to go to sleep, and that was after 1 or 2 cups of this highly kind of caffeinated espresso-like coffee. Caffeine is no joke. It will affect your sleep.
You think that's the number one problem with sleep?
Let's
just call it one
I don't
of them, right?
know. I don't have a study to back me up on that. But I would say that is one of the first things that are easily changed,
right,
for you to address, especially before you're coming to the doctor to say, I want pills, or I've done everything I can. So the first thing is think about the caffeine and think about when you're drinking it and try to time it a little bit better. So I think before we get any further into like treatments of insomnia or other diseases, let's talk about sleep a little bit, right? So we know how important sleep is. We all know how poorly we feel when we don't get sleep. I mean, it has gone all the way back to the 15th century, and there's documentations of, discussions about how sleep deprivation causes physiologic effects. And it was very early that they realized that this was actually a great way to even get information and torture prisoners. So, keep someone sleep deprived for 3 or 4 days was a good form of torture. And anyone who's gone a couple of days without sleep knows how difficult it is to think, to perform simple tasks. And they've done these studies over and over again. So someone playing a video game who's slept well versus someone who has not slept well cannot do as well. So talking a little bit about sleep, going back to your psychology courses, Jeff, you're talking about two types of sleep. There's REM sleep and non-REM sleep. REM, R-E-M, stands for rapid eye movements. And to just kind of go through the stages a little bit, there's three stages, of non-REM sleep. And these occur pretty quickly, like when you first lay down, okay? So when you first lay down, your eyes are closed, but it's easy for you to wake up, okay? Mm-hmm. It may last 5 to 10 minutes, kind of a preliminary stage. Stage 2, you're in a light sleep. Your heart rate starts to slow down. Your body temperature drops, and your body's kind of getting ready for sleep, getting ready for that kickoff. Stage 3, this is a stage of deep sleep, okay? Again, non-REM, but it's a stage of deep sleep. It's harder for you to wake up if you're in this stage of sleep, in this phase. If someone woke you up in this phase, you'd be a little bit maybe disoriented for a minute or two. That's when that phone rings and you're like, who's on the other line, because you're a little disoriented. So that's at stage 3. Important part of stage 3 sleep, and this is kind of what we were getting to. This is the stage of sleep, and it's non-REM sleep, where the body repairs and regrows tissues, builds bones, muscles, and strengthens the immune system. So if anyone says, what happens when you don't get enough sleep? Your immune system drops down. It can stunt growth, impede muscle growth, all of those other things.
All right, so we're coming up on a break, Chris. I'm going to stop you right there. So we've learned about the 3 levels of sleep. We're here with Dr. Chris Mahr from Colonial Family Practice, and we will continue to learn about why we can't go to sleep at night.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
We're back, Medical Forum. I want to thank our presenting sponsor, of course, At Your Service Home Care, 1250 Wilson Hall Road. For all your home care, your concierge, steward, your guide, giving you all kinds of home care and beyond. Those that want an alternative to a nursing home or assisted living, call them up in the office. Addis, Christy, and Sharon will take good care of you with all their 45 to 50 different attendants. Do a fantastic job. Chris, when we left, we were talking about different levels of sleep.
Yeah, I was talking about the non-REM sleep that occurs before REM sleep. One misconception that we talked about in the last segment was, do I still need as much sleep now as an adult as when I was younger? And again, I truly believe this is a misconception. As you get older, you sleep lighter. You don't sleep as heavily as you do like an infant, correct? And you don't get as much deep sleep. So aging is also linked to shorter time spans of sleep. Now, that could be for a whole host of reasons, our lifestyle, what we have to do, waking up in the morning, things of that nature. All those studies still show that you need as much sleep as an adult as when you were younger.
Now, would that adult also constitute elderly?
Absolutely.
Okay, because we always talk about, my grandparents, they go to bed at 7:30, but they're up at 4:30. I mean, if you do the math, it's no different than if you went to bed at 10 and got up at 7.
Sure.
So we're really talking about the same time.
So that cycle has been changed,
right,
or moved to a different period, but they're still requiring the same amount of sleep.
Okay.
So I just covered all of the periods of non-REM sleep. And again, remember that non-REM sleep, which is that pretty deep sleep that takes a little bit to get into. That's when you're repairing your body, right? Repairing your muscles. So all of those, health nuts who are exercising, if you're not getting adequate sleep, you're not repairing your muscles at night. You're not growing muscle. You're not. So athletes, it's very important for athletes to get a lot of sleep.
Philadelphia's head coach, he got fired, Chip Kelly. I don't know if you listened to him, but he was a huge coach behind sleep, beds. He made them sleep in certain beds. I'm talking about Philadelphia Eagles professional football team. He had their athletes get at least 10 hours of sleep. When they were not on the practice field, he would regulate and make sure that they were asleep. He had a certain type of beds, certain type of pillows. So he was a big, big backer of that and was known as a notorious coach for running his players into the ground. I mean, they were the most physically fit players. So I think that goes hand in hand with what you're saying.
Absolutely, because it's going to take that sleep to build the muscle, regenerate the muscle.
So high school kids that are playing sports, that are listening out there, that they're out there, they're constantly shooting basketball, say, in their backyard, or softball players hitting and all that. Diet we've talked about. Next week we'll talk about diet at a very high level. But you're saying, Chris, that these athletes that are really conscientious, sleep is something that they need to look at any age.
Without question.
Gotcha.
Okay. So we talked about the non-REM sleep. Let's get into REM sleep, REM, rapid eye movement. Typically, REM sleep happens about 90 minutes after you fall asleep. So it takes a while to get into it. Now, REM sleep is where you get your Z's. Okay, so that is where you are plugged in, you're recharging your batteries, you are really getting that deep, deep sleep. This is the period of time when dreams occur, but you're really recharging your batteries for the next day. Now, you go through periods of REM sleep. So depending on how long you are asleep at night will determine how many episodes of REM sleep you go through. So the first period of REM sleep typically lasts about 10 minutes. Then you come out of REM sleep, right? And then if you're sleep long enough, you'll go back into REM sleep again. And each episode of REM sleep you go into, you stay in REM longer.
Is it deeper or longer? So
longer.
Like when you mentioned 10 minutes, it might
longer.
Go to 30
right.
and then 50.
Exactly.
So not so much deeper, just you stay in it without interruption.
And then the final one can last up to an hour.
Okay.
So you think about it, it's kind of like we're going to be asleep the whole night. Our eyes are closed, but we need that REM sleep to really recharge our batteries for the next day. And so we have to be asleep long enough so that we have that 10-minute period in the first REM, then we knock out. Then we have another period where it's a little bit longer, and then we knock out of REM sleep. And then maybe we got to get to the third one. That's an hour, and that's really going to give us that deep, restful sleep so that we're recharged the next day. But it takes 8 to 10 hours to get through all of those periods of time.
So it's fair to say then that if I'm someone who's not getting the 3 or 4 hours of sleep, going back to your med school days, my days of cramming in school as well, we have not been able to complete our REM sleep.
Yeah. And to give you an example, infants can spend up to 50% of their time in REM sleep, whereas adults only 20% of our time.
Why is that?
It's a physiological effect.
Okay. So when people get up in the morning after failing to have REM sleep, this can affect, like you said, their job, their appearance, their health, their physical activities, probably their disposition, I would think.
All of the above.
Yeah. So it's very important. So let's talk about the next phase of insomnia. So we've talked about the REM sleep and the 3 levels of getting to REM sleep, and then the progression and how important sleep, no matter whether we're an infant or whether we're elderly, is important. What's next?
So we talked a little bit about what healthy sleep is, and this is our goal. Our goal is to 8 to 10 hours, REM sleep, a couple of phases of REM sleep, and the goal is to get to that point. So how do we get to that point? And so I wanted to talk about a few things that affect REM sleep in a either positive or negative way. And I'm going to start with we'll start with the negatives, right? And
is it going to be our same ones from diet, smoking to drinking?
Yeah,
well, let's just go ahead.
Those things don't help.
Tip them off.
Man. I can start with some of the obvious ones.
We got about a minute and a half. See if you can cover some of it, and we'll come back and cover the rest of them. So take your time.
So I'm going to talk about the kind of the things that really affect the REM sleep, and again, that's recharging your batteries. So light is actually really important, and some people sleep really well in dark rooms. Some people sleep really well in rooms that might be lightly lit with a nightlight or something to that effect. But ultraviolet light or fluorescent light can really negatively affect sleep. And so, for instance, someone who sleeps during the day may absolutely need room darkening blinds because ultraviolet light can shut off hormones like melatonin and really impair sleep. So light influences our internal clock through specialized light sensors in the cells of the back of the eyes.
Mm-hmm.
And so even though, you have your eyes closed, there's small amounts of lights that can be filtered through and can affect our sleep pattern. Lots of factors that can affect REM sleep that are kind of obvious. Jet lag. I mean, how many, there's a little equation of every hour of time change takes however many days it's usually 1 hour takes about a day or so to compensate for. So, jet lag of 4 hours takes four days or so for your body to get back.
I didn't know that.
On
Chris, we're going to come up on a quick break here. I want to hear some of these symptoms because I think this is going to hit home with a lot of people. You're listening to Medical Forum, and we'll be right back with Dr. Chris Mahr.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admission Instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back. Thank you all for joining us on Community Broadcasting Network here on 105.9 Talk Radio throughout Sumter and the surrounding communities, coming to you here on Saturday morning. If you missed some of the show or want to catch it, we also re-air on Sunday from 2 to 3. Insomnia is our topic. Dr. Chris Mahr. Dr. Chris Mahr, we're talking about all of the symptoms or things that help attribute to some of our sleep apnea. When we left our sleep insomnia and such. You mentioned about lighting. You mentioned about time zones. What else we got?
Yeah, so just to get real back quickly to the jet lag and time zones, it takes several days to recover from jet lag. One of the things that can be done is an example of traveling. I traveled to Europe last year. So you get up early in the morning or you fly overnight, and then you're going to do a day almost without sleep. You might nap a little bit. The goal is to try to get back on schedule as quick as possible, and melatonin has been shown to benefit sleep disorder due to jet lag.
Do you find when I've flown overseas, I've always done this, and I think it helps. I don't know if this is a rule of thumb, but to go ahead and stay up for the current time zone that you're flying into.
That was exactly my point.
Yeah.
Get back on that schedule as soon as you can. Exactly.
Okay.
Exactly. Another factor is shift work. Shift work is awful for your circadian rhythm. It is so hard for your body to adapt. And I've done shift work jobs before as a resident. We worked all through the night oftentimes, and shift work sleep disorder is a real problem, and it often requires very aggressive treatment. And I am very apt to treat these types of patients with medications just to help them get through. It's
when you
very
refer to
difficult.
that, somebody maybe works a third shift for a month at a factory and then goes on to first shift.
Exactly. And you know what I'm finding, Jeff, is it's not even a month. If they would say you're going to work nights this month, evenings this month, and days this month, that would be less. Some of my patients are swinging week to week to week.
Yeah.
So they might be a week on days, a week on evenings, and a week on nights. And that is really difficult for your body to get used to.
How about the 12-shifter people like a fireman or a nurse? Is that as much as long as it's consistent and you're able to be up 12 hours and then be off 48?
But it's the variation. So some firefighters, for instance, may work nights only. They may work nights. But then when they come back and they're off and they're spending time with their families, well, they're not back on nights. They're trying to sleep at night, and they're trying to sleep during the day. So this is a real problem. It's actually can be very difficult to treat. There are medications out there. There's medications you can use to help you stay awake, very safe drugs like Provigil or Nuvigil. And then there's medications then again to help you sleep, which we'll talk a little bit about later, mostly the insomniac drugs. So some of the other factors, that negatively affect rapid eye movement, pain, patients who are in chronic pain, difficulty achieving and maintaining rapid eye movement, anxiety. We've all had that laying in bed and thinking about
everything.
Something.
Yeah.
I mean, that is the time of the day when it's all quiet and your mind oftentimes just races. And those racing thoughts sometimes can be very difficult to get a handle on. So pain, anxiety, and then certain medical conditions obviously can
How about single mothers maybe with 3 kids and all different ages, and you've got an 8-year-old, a 6-year-old. I'm sure there's people out there that are sitting there nodding their head going, I can relate to that. And then you throw in that you maybe have an infant.
Oh, absolutely.
I mean, so you're on 3 different sleep patterns with them, let alone your own, and then are asked to perform your work after dropping off at daycares and then juggling. It's got to be
sure. And new mothers who might be feeding the baby at night. And, I don't know how hopeful you were, Jeff. But,
a lot of people don't know. I breastfed my kids.
I would imagine. I'm going to ask your wife next time. I'm going to confirm that fact.
I was a great father because I wanted her happy. If I'd rather be unhappy. Agree, Chris?
Yeah, I'm going to fact check.
Okay,
I'm fact checking.
Wait till next week. I'll have proof.
But for a new mother, the old adage is sleep when the baby sleeps. But if you have a second child to combat that or compound that, very difficult. So it's very difficult just to sleep whenever. Yeah, absolutely. Those are all factors.
Let me throw a couple curveballs questions to you here a little bit. What's some misconceptions that people think, let's say they don't have access to a physician and they want to go to sleep? I mean, common theory, anyone who's ever spent time around someone who drank too much and you look at him on your couch passed out, is this a form of a way to go to sleep, or is it actually counterproductive?
So alcohol negatively affects rapid eye movement and decreases the time that you're in rapid eye movement at nighttime.
So you may pass out, but it's not good sleep.
It is not quality sleep. There are several other drugs that affect rapid eye movement sleep. We talked about caffeine. Caffeine is one. Antihistamines. Antihistamines, like Benadryl, will decrease your time in REM sleep. Now, if you look at most, or I shouldn't say most, but many of the over-the-counter sleep aids, the active ingredient is diphenhydramine, and that is the generic for Benadryl. So these will help. These will cause sedation. They will produce a sleep state quicker, but can negatively impact REM sleep. So not necessarily the best things
cold
for
medications.
sleep.
Or let's even specifically, let's talk about a NyQuil.
But again, even some of the medications that are labeled for sleep, are the active ingredient is Benadryl, which is an antihistamine. So not necessarily the best.
So it might conk you out, but you're not getting a lot of good rest.
You're not getting quality sleep.
You know, I took NyQuil on occasions when I've had a cold, and the two things I remember: falling asleep quickly and never ever feeling up to par the next day.
Yeah,
that side effect.
So a little bit of morning sedation, little grogginess, absolutely.
And I don't know that
I hear that a lot.
Yeah, and I don't know that even throughout the day I progressed, but I don't know that I ever got back to where I felt that great. So, so is it a recommended? Do you recommend that if someone has a cold? You know, we talked about this a little last week. Sometimes we take something because the big effect that we're trying to achieve might have a side effect. So with someone maybe having a cold, we know that if we have to take this Benadryl or a Zyrtec or a NyQuil, are we encouraging people not to do that or encouraging people to do it but understand that they may feel groggy the next day?
Yeah, well, I've said this on the show before. All medications are a risk-benefit ratio, right. And so you weigh out the scale of is the risk greater than the benefit. Benadryl is not a drug that I recommend a lot. It's great for use in the hospital for allergic reactions. It's not really a drug that I recommend a lot of. For allergies, there's non-sedating antihistamines like Claritin, Allegra, and Zyrtec. They all of which have generic brands. Much better alternative to Benadryl. For cold symptoms, Mucinex, just guaifenesin, which has little effect on sleep. Better alternative.
Got you, Dr. Chris Mahr on Boltman with Colonial Family Practice, and we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, Admission Instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We are back on Medical Forum. We have one last segment with Dr. Chris Mahr, and we are talking about insomnia, and we talked about in the last segment all the prevailing problems from drinking to sleeping to traveling to drugs, from cough to all of the things that keep us awake that we may either think helps really solicit sleep, or we take because we have to necessary evil, but it also affects our REM sleep, Chris.
Absolutely. That's kind of what we're talking about.
Yep.
There were two medical conditions I want to touch on very briefly that negatively affect sleep, specifically REM sleep, but your entire sleep pattern. The first one is obstructive sleep apnea. And we have talked about obstructive sleep apnea
Huge
various
problem.
times. Huge problem. The hallmark symptoms of obstructive sleep apnea are snoring, periods of witnessed apnea at night, and daytime fatigue. So any of those three symptoms, go into your doctor, have a sleep study order.
Yeah. Reliable medical equipment, we probably do, Chris, I'm not kidding you, probably $400 to $500 a year. When you talk about the sleep apnea aspect of it, basically to qualify by Medicare standards, you've had 99 episodes in this 8-hour period that we've talked about where you have woke up. And the treatment for that is what's called a CPAP. So Reliable Medical on 246 Broad Street, one of our great sponsors, handles those in mask, and they get you all set up. But it is a very, very serious, and death has been one of the causes of it.
Absolutely.
Yeah. What else?
So one other medical condition that I'd like to touch on briefly is called restless leg syndrome. I remember when this first came out, we kind of swept it under the rug a little bit, questioned the validity of it. This is a real problem.
What is it? I've heard of it. I don't know what it is.
So the classic symptom for restless leg syndrome is an insatiable urge to move your feet when you lay down in bed at night. And the symptom is often improved by getting up and walking. So, and then it resolves. So patients will say, gosh, I lay in bed and my feet, I just have to move them. I just feel like I've got to move them and twist them and turn them and push them against the mattress. And I can't keep them still. And then I get up and I walk up and down the hallway and it makes it better. And then they get back in bed and the symptoms can either recur or sometimes extinguish.
So it's like a tremor. I mean, you're sitting there. Are you literally going up and down?
It's a voluntary movement. It's not an involuntary movement. So a tremor is when your hand or your limb might be moving, but that's more of an involuntary type movement. This is a voluntary movement. This is an urge. It's not really a tremor.
Is anxiety attributed to that?
Well, there's a whole host of factors that can cause it or exacerbate it. And yes, I think anxiety is a component to it, or can be a component to it. But again, it's just a very real condition. And other than pharmacotherapy, I don't know about many treatments that are very successful for the treatment of restless legs. And it's usually there's a medication now called Requip. That's one of the medications. There's a couple other medications that have been out that have treated tremors and seizures that work. But for instance, the medication Requip can be dosed at night before you go to bed, an hour before you go to bed, and relieve the symptoms of restless legs.
Is this age related? I mean, are there high school kids coming in here to see you about that?
I have some young patients with
Really?
restless legs. Yeah.
Wow.
Yeah. I have suffered with restless legs in the past.
Really?
It's very uncomfortable.
Is it painful?
No, not at all.
Because I'm thinking of where people where their feet fall asleep.
It is not painful. It is just nerve-wracking is the only way I can describe it.
And you can't stop it. I mean,
it's just a sensation that your feet. You need to move your feet to relieve the.
So you get up, you pace around a little bit, and get back in.
Yep.
So if somebody has this and they're trying to sleep at night, obviously the sleep is being stunted. So because you have to do this quick little exercise.
Yeah. We diagnose this a lot when we do sleep studies. So our sleep lab will put those notes in the chart. So when they observe sleep, they'll document if there's periodic limb movements.
I might have it. I have 4 dogs that get me up in the night most of the time. So maybe I have it. I just have never gotten enough sleep because of these dogs.
I can tell you how to fix that, but I'll tell you after the show.
Okay. Does it have to do with the taxidermist at all?
Your wife and kids might not be happy with me, though.
Oh, they might be.
So, we have about a half a segment left. Let's just hit on a few of the ways to improve everything. I really want to talk about the problem of sleep because the treatments, there's not a lot of treatments, but there's a lot of things you can do, pharmacologic and non-pharmacologic. I don't even want to talk much about the pharmacologic effects. Everybody knows about the medications. The medications do work, and I'll talk about that in a second. Let's talk about non-pharmacologic treatments. These are non-medication forms. Cognitive behavioral therapy. This is therapy that can be done with counselors and psychologists. It works. And actually, most of the recommendations I looked at this morning show that it's beneficial and should be considered first-line treatment of insomnia. We talked about this, and I hit upon this last week, exercise. Moderate intensity exercise will certainly benefit insomnia. Now, you did make the comment about not doing this just before you go to bed. It's probably not a good idea to hit the gym, hit the shower, and go straight to bed. That cycle is probably not going to produce good sleep, but moderate intensity exercise throughout the day is going to produce better sleep. Relaxation therapy. Relaxation is something that we all, I think, struggle to do. I don't think most of us Americans relax well, but there's a process of kind of tensing and relaxing different muscle groups, and going through them systematically. A lot of people start maybe in their feet. They tense the muscle group, they relax it, and they do that serially until they work their way all the way up to the head and try and tense all the muscles up. Relaxation therapy works. One of the things it does is it's a distractant therapy. It distracts you from whatever you're thinking on. That's how meditation works. Meditation is clearing your mind, so it's concentrating on nothing, right? Mm-hmm. Concentrating on the wind blowing, concentrating on your breathing. So if you focus solely on the breath going in and out of your lungs, it's a distractant of the other things like the business meeting that went awry that day.
Right.
So distractant. So relaxation therapy, really important. If you have insomnia, I would look into this.
How about green tea?
Well, green tea is a stimulant. No, green tea take in the morning.
So
not
taking
night.
your little hot toddy, or not hot toddy per se, but a hot tea, or a lot of people like to have a little tea. They think that it's not the same as coffee.
Yes. So tea has caffeine. Tea can be a stimulant. Green tea has additional stimulants above and beyond caffeine. So I do not recommend tea at night. Having said that, there are some teas that have been
like the
recommended,
Keurig machines for coffee. They have one that's a sleepy time.
Yeah.
Okay.
It's chamomile. Chamomile tea has been implicated in improving insomnia.
Dr. Chris, we have 15 seconds. Tell us one important thing that we need to take away, and I think this subject could be touched on many more times.
So again, exercise during the day, no caffeine 8 hours before you go to bed. Try to improve relaxation techniques before you go to bed. If these fail you, see your doctor about medications.
You got it. Chris, thank you so much. I know that I've learned a lot, and I hope everyone else has. Please join us again next week on Medical Forum.